Intravenous drug use, tattoos, body piercing, and contamination of the blood supply are the major factors contributing to the hepatitis epidemic in the world. Since the early 90s, the U.S. and many developed countries have screened their blood supplies for hepatitis, HIV, and other diseases, so the risk of getting hepatitis and HIV from transfusions is practically zero.
It doesn't tickle.
Tattoos and piercings are still risky, particularly so-called street tattoos or tattoos in prison, where you don't know if the needle or the inkwell have been contaminated. States and municipalities are increasingly requiring tattoo parlors to follow universal precautions for licensure.
We're in what they call a biological monitoring program, which is we send a spore test away monthly to a laboratory. So they just let us know and reassure us that our autoclaves are working, get to the certain temperature and a certain amount of pressure.
But unfortunately, just this year, citizens of Las Vegas, Nevada awoke to a new problem: a blatant disregard of sound public health principles.
8 confirmed cases of acute hepatitis C found in Las Vegas may only scratch the surface in the valley's current health crisis. Now, 50,000 people may have been exposed to hepatitis and HIV due to unsafe injection practices.
I just think that, people should be careful, because I might have had gotten AIDS. I could have been dead, with 7 kids, just left without nothing. Since being in here, I feel so bad because I'm not there. And I don't want them hurt ever again. And they say, "Don't worry, Mom. We love you. And you just take care of yourself. I'll do good when they get out." It's kind of scary. I'm kind of scared. But I think I could do it.
Yes. Oh, yes.
Lisa and other patients undergoing hepatitis C treatment meet regularly to compare side effects and support one another's treatment.
Fatigue and bitchiness.
Can you relate to any of those side effects?
But I mean,
I'll deny it.
Oh, and the body aches. My body hurts. My legs almost, I can't walk sometimes. But other than that, I feel great.
I like being clean. I just didn't really like being on drugs, but it killed the emotions, so that's why I did them. I want more in life. I want to see my kids grow. I want to be part of their life. I don't want to be sick. I'd rather just, live my life and be rid of all that's bad and in it and leave all that behind me.
Carolyn is undergoing her second treatment. The first time she was treated, she had to stop because of side effects.
Hey guys, where are you? How are you? Good. Anybody call for me? Not this morning yet.
I talked to my employers. They were very understanding. I was told if I didn't feel good or if I needed some time off to take it. My immediate supervisor was very much behind me. He was very, very supportive, and I did have that opportunity to at least be able to have something to occupy my mind besides myself and what I was going through on the treatment.
If there's nobody else, we'll get started. Let's go to first to Dr. Sava in Edgewood, first choice.
Thank you. Second patient is patient LK. This is a 27-year-old woman who started treatment 11/19 of 07.
Lisa, Carolyn, Victoria, and hundreds of other patients living in health underserved communities across New Mexico are now receiving state-of-the-art treatment for hepatitis C and other complex chronic diseases.
Genotype 1, She had an initial viral load of 17,000. Her current CESD is 6. Her full-week viral load...
The First Choice Edgewood Clinic, the state's prison medical services, and many other rural and urban clinics are now linked as part of a unique health network through the internationally recognized Project ECHO. Based at the University of New Mexico Health Sciences Center, Project ECHO uses closed-circuit television and internet connections, allowing rural practitioners to consult with a panel of experts in hepatitis and other chronic disease management at the medical center.
If they are negative at 4 weeks, the cure rate is likely
We don't
to be...
present ourselves as, I'm a liver expert to manage your hepatitis C. We present ourselves as, I'm a primary care provider, and the advantage with this model is you could come here and we can manage your care. And we're going to do it because I'm going to be having the weekly support of a team of docs that if anything comes up, they're going to be right there to answer our questions and help us along with that.
Social worker here who specializes in services for undocumented people.
What happens, April, is that
there is a health crisis in our country. Care is fragmented, disorganized, and very costly. There are enormous health disparities, particularly for the poor, minorities, and rural people. Project ECHO's mission is changing the system.
Okay, so we had a negative viral load at 4 weeks.
Using the latest technology to connect the very best resources for patient care. In the process, rural practitioners in New Mexico and around the world are learning how to better manage chronic disease in their own communities.
And I just wanted some guidance from Dr. Thornton in particular, maybe on...
Are there anything in particular we should be doing with Hep C treatments, patients in treatment that develop MRSA?
It's just a wonderful model for a way to deliver healthcare. And I think it's going to be a model that's going to be translated across our healthcare system in this country and certainly in other countries around the world.
Hepatitis C is sort of like the canary in the mine. It's a reflection and an indicator of bigger, broader issues and problems. We're talking about drug abuse and especially injection drug abuse. We're talking about drug addiction. We're talking about other high-risk lifestyles, which in and of themselves are connected to low economic status and low educational status. And so we're really not going to be able to claim success in controlling hepatitis C until we can claim better success with drug problems, which means getting better success with economic and education issues here in New Mexico.
In addition to hepatitis and HIV infection, injection drug users face a more immediate complication, death from an overdose. Whether it's teaching the use of Narcan, a medication to reverse an overdose, or giving addicts clean needles, public health experts know that education can save the lives of people at risk. The strategy is called harm reduction, and New Mexico has one of the most innovative programs in the country.
Okay, you have to give a pretty good push. Go ahead and try it and see how hard you have to push to make it.
What we really try to do is try to make sure that injection drug users are using clean syringes, clean works, so that they're not transmitting hepatitis C when they're sharing syringes. Anywhere between 87 and 93% of all injection drug users are hepatitis C positive. And the CDC has really estimated that in New Mexico there's about 36,000 people who are infected with hepatitis C.
My wife, my partner, she's had hepatitis for probably 20 years. Myself, I didn't get it till just a couple of years ago.
And therefore, how many people?
6 people.
6. There you go. You want some food and water too?
Sure.
We see a wide range of knowledge base to start with. Some people come in, they already know a lot about hepatitis C, but then we have a lot of people who come in who don't know anything about hepatitis C at all. And so we spend a lot of time educating them about modes of transmission, for example, not to share syringes, and then we work with them a lot about what to do if they are Hep C positive and help refer them into programs like Project ECHO to see about them getting treatment.
Now, I don't need to know results, but have you been tested for hepatitis C?
No.
Okay. Have you been tested for HIV?
No.
Okay. And have you been vaccinated for hepatitis A and B? Okay. Now, the hepatitis A and B vaccines and the HIV test we can all do today. Yeah. And the hepatitis C test we can do down at the Healthcare for the Homeless Clinic.
We acknowledge that drug use happens and that it's there, and we try to keep people as safe as we possibly can. It's not just the people who are injecting we're also trying to keep safe. It's also the community members. For example, there used to be a lot more syringes that were found in the alleys and in the streets and in parks and playgrounds. But now one of the things that we do, we don't just give syringes to people, they have to bring them back to us so that we can dispose of them properly, so there aren't as many syringes out on the street. So that's keeping the community safe. So it's taken time, but we've been able to recognize and be recognized by the community in many different ways. There's still a long way to go, though. There are still people who don't understand syringe exchange, don't understand what it does, who really think that it's just about, giving drug users, basically enabling them. And while I'll say I am an enabler nowadays, I enable people to live safely. I enable people to live with dignity. That's what I enable.
The management of chronic, potentially fatal diseases like hepatitis C poses significant dilemmas for our country and the global society. We need to make decisions that balance the increasing cost of medical care, particularly for poor, isolated, and disadvantaged populations, with both compassion and the need to protect the public's health.
And my question is very specific.
Projects like ECHO and harm reduction strategies improve access, communication, education, and treatment.
It's going to be great. You're going to do great.
They are models for better quality and delivery of health care for all.
How are you?
Good. Nice to see you.
Nice to see you.
How are you doing?
I'm okay. I'm waiting for my big news.
Okay, well. So one thing that's very good to report that all the side effects of interferon are all over.
Yes.
Your hemoglobin is back up to normal. Your liver function tests are normal.
Right.
And the best part of the news is that your virus is negative. You are cured of the hepatitis C.
That is unbelievable. Thank you.
Yeah.
Thank you. Hey there. Guess what?
But this is an amazing achievement because now you're cured of the virus, it's permanently gone, and we have a lot of good data that it never comes back. It never comes back.
I'm still virus-free. Yeah, and Dr. Aurora feels that I'm cured, that I will not have a problem with it.
Essentially, all the damage that has occurred to your liver over the last many years is going to now be reversed because the body's healing processes will step in and they'll essentially make your liver just like new again.
Isn't that amazing?
I'm going to get my life back.
Yeah.
I'm going to work that hepatitis C.
Partial funding for the production of this program provided by the New Mexico Department of Health.